Schistosomiasis is also known as bilharzia or snail fever. It's a parasitic disease that's carried by freshwater snails that are infected by one of the species of the parasite Schistosoma. Infection of humans occurs by contact with contaminated fresh water that's inhabited by the snails that carry the parasite. Larvae, which are known as cercari, emerge from the infected snails, and they swim in the water until they come into contact with an individual and penetrate through the skin. The transmission to humans, therefore, can happen through a range of just normal water contact activities, such as collecting drinking water or bathing, washing clothes, swimming, or fishing. Once inside the body, the larvae develop into worms, which live in the blood vessels for years. And the female worms will shed eggs, some of which end up in urine and feces. And if infected people then urinate or defecate into fresh water bodies, the eggs will migrate to snails where they hatch and they begin the whole cycle again. The symptoms of schistosomiasis can include frequent painful and bloody urine, abdominal pain and bloody diarrhea, inflammation and scarring of the bladder, enlargement of the liver or spleen, and if infection persists for a long time, bladder cancer may eventually develop. It's particularly harmful in children, where it leads to anemia, malnutrition, and learning difficulties. So it dramatically impairs their future quality of life and productivity. It's estimated that currently approximately 260 million people are infected in about 78 countries worldwide. And about 90% of the infections occur in Africa. It kills an estimated 280,000 people annually and ranks second only to malaria as the most common parasitic disease in the world. It's also classified as what's called a neglected tropical disease, or NTD for short, though it's been said that the problem of NTDs, of these types of diseases, is really more about neglected people. In other words, it's the poorest people in the world who are most at risk. A drug called praziquantel is the primary form of treatment, and a single dose of this drug has been shown to reduce the burden of infection and severity of symptoms of schistosomiasis. However, reinfection will quickly occur when people are re-exposed to contaminated water again. So education campaigns about the risk of exposure to contaminated water and also improved water supply and sanitation are really important and should, in theory, break the life cycle of the disease. Now, universal sanitation coverage and usage should prevent the passage of urine and feces into contaminated water bodies, but there's always a danger of transmission by infected people who visit from other nearby schistosomiasis endemic regions and urinating or defecating into the water body. Or there's also the risk of occasional lapses in the usage of the sanitation facilities. Mollusciciding has also been suggested as a solution, so trying to kill the snails. And that was the primary form of control before praziquantel existed. But there are concerns regarding potential unintended consequences of using molluscicides. And also of dosing molluscicides into water bodies, and the long-term effectiveness and sustainability of that strategy is uncertain, because in theory, even one remaining snail could repopulate a whole water body very quickly. In some cases, there may be untapped water sources nearby which can be accessed, such as protected groundwater boreholes. However, often there are no alternative safe water sources available to meet the full water needs of communities in these regions. So in such cases, the immediate focus for cutting schistosome transmission would turn towards treating the contaminated freshwater body to provide a safe alternative water supply for the community. Our findings from a 2013-14 national mapping program in Ethiopia relating water and sanitation conditions to schistosomiasis infections supported this logic and showed that there is that with increased water contact, more than anything else, this is statistically linked to schistosomiasis infection likelihood. So there's very limited or incomplete information available currently regarding the effectiveness of different low-cost water treatment and sanitation options at containing, removing, or inactivating the larvae, also known as cercari, which cause schistosomiasis. So water treatment solutions for fecal-oral diseases, such as cholera, may not necessarily be effective against cercari, since they are physiologically completely different organisms from the bacteria which spread such diseases, and they may have different resistance or sensitivity to water treatments. Secondly, there are no real field-ready, rapid, cheap means of detecting cercari in water samples and determining their infectivity. So that makes the risk, assessing the risk and the degree of contamination of a water body, and also being able to test the effectiveness of water treatment processes as barriers against the cercari, it makes those processes very difficult. Finally, there's also a need, importantly, for developing and testing integrated strategies for controlling the disease. So combining mass drug administration using praziquantel with environmental control methods such as improving water, sanitation, and hygiene, providing health education, and possibly also mollusciciding. So what we are doing is bringing together partners who are active currently in schistosomiasis endemic countries in implementing each of these control methods. And we're aiming to see how we can come, how close we can come really to elimination of schistosomiasis through working closely together, and importantly, how this can be done most cost effectively.